This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
All right, so when it comes to your health, you know the importance of getting screened for certain conditions. Unfortunately, you probably also know people who just don't have time to go get screened because they have too many other important things to do. For that matter, you may be one of those people.
Yeah, that's why, or one of the reasons why the team at PRMC constantly strives to make healthcare services more easily accessible for everyone. And one way they do that is with something called the Wagner Wellness Van.
Delmarva Live's Sydney Whitfield caught up with the van in Salisbury to learn more about some of the services that you can take advantage of. Sid?
When it comes to accessible health care, we've heard of things such as walk-in clinics or urgent medical centers, but a wellness van is a new one for me. And here to tell me more about it is Catherine Fiddler. She is the Vice President of Population Health at Peninsula Regional Medical Center, and also Donna Nordstrom, and she is the Director of Community Health at Atlantic General Hospital. Ladies, thanks for being here today.
Thank you.
So, Catherine, it's not quite a walk-in clinic, right?
No, it's not. We know that access to primary care on the Eastern Shore is significantly a problem for many, many people. Add into that transportation, add into it lack of insurance or ability to pay, and people have a really hard time accessing care. So that's what this opportunity is. This wellness van is a bridge to improved quality of care, coordination of care for our community members.
And the Wagner Wellness Van is a partnership of 3 different entities, correct?
Absolutely. It's a partnership between McCready, between Atlantic General Hospital and Peninsula Regional Medical Center through a grant from the Health Service Cost Review Commission of the state of Maryland.
Donna, tell me more about the partnership.
Sure. Atlantic General is excited to be a part of the Regional Grant Partnership, and it's all about access to care. That's a common health concern and a health need that we see in our area, a common thread through all 3 counties. So when the van comes into Worcester County, AGH staffs them with 1 registered nurse, and we're able to provide accessible community care, meeting community members where they are, and to help remove those barriers to care.
Great. And the van's right behind us right now. I'd like to get a tour if that's okay, right?
Absolutely.
All right, let's go.
All right.
So right now I'm here in the Wagner Wellness Van, and I'm astonished by the size of this van. And I'm here with Stephanie Elliott, Director of Community Health Initiatives at Peninsula Regional. So tell me about the types of people that you're looking for to utilize the van.
Okay. Well, we do screenings and we'll do those on anybody. So if somebody just wants to come in and get their blood pressure checked or check on their diabetes, we're happy to do that. We also see people who are uninsured, who do not have their own primary care provider, people who are underinsured, who may have a really high deductible and aren't able to meet that deductible, so all year long they don't get to use their insurance and they just can't afford that. So we're happy to see those people as well.
Okay, so that you're really meeting that need. And what's the first step when people walk in the van?
Okay, when somebody comes into the van, this is our intake area, and we would have them sign a consent form. Height, weight, and usually blood pressure are done here, but sometimes blood pressure is done in here. If they have some educational needs, we usually do that in here as well. Anything that the patient needs that they would ordinarily get in their primary care provider's office, we can do right here.
Okay.
We have an EKG machine, so if someone needs to have an EKG done, we can provide that right here. We have a blood draw station, so we can draw labs and have them sent and then get back with the patient, let them know what those results are. We can even do a hemoglobin A1C. We can have those results right then when the patient's here. We have lots of resources, lots of educational things from all 3 counties. So anything basically that the patient would need as far as resources, we can connect them.
Okay, and a lot of people don't know that they don't have to go to the emergency room for everything. They can actually utilize the van, right?
Exactly. A lot of people do go to the emergency room because they don't have a primary care provider, and we can actually see those people right here.
All right, awesome. Stephanie, thank you so much.
Thank you.
All right, it's nice to see something like this in the community. Jimmy and Lisa, what do you think about this initiative? Pretty neat, right?
It is.
It is neat. It is amazing what PRMC can put on wheels and bring to you just to make sure it's real.
And they had it out at the beginning of the marathon, the Salisbury Marathon. You could actually get screenings before you ran a race. Pretty interesting.